Hello, Ladinia Petway from Capella University, class NURS-FPX4050 for Professor Jessica Taylor. Care Coordination Presentation to Colleagues. Care coordination in healthcare encompasses several activities in patient care organization for effective service provision. Communication gaps are bridged and aspects of care are integrated, leading to improved outcomes and increased efficiency in healthcare. Care coordination is especially necessary for patients with complex needs whose requirements for care usually spans many providers and multiple settings. Good care coordination ensures less fragmentation of services, fewer errors, and more continuity of care, benefiting both the patient and the healthcare system. This presentation focuses on exploring strategies and challenges in care coordination, emphasizing nurses' important role in implementation, the important aspects involving elicting patient and family engagement, addressing ethical decision-making, managing changes to improve patient-centered care, and understanding the impact of healthcare policies. This presentation will address areas where nurses can improve care coordination practices within primary healthcare settings for better patient outcomes. Strategies for collaboration with patients and families. Care coordination incorporates patient-centered care, respecting patient and family preferences, needs, and values. According to Generica et al. 2023, patient-centered care builds trust and collaboration through patient and family engagement in making decisions. In such a way, care plans always address individual circumstances and enhance patient quality of care and satisfaction. This can be achieved through effective communication, effective engagement of the patient. According to Qatari et al. 2023, clear and open communication helps patients become better understand their care plan, enabling them to make informed decisions and adhere to treatments. Moreover, engaging patient and their family establishes a partnership that improves care outcomes. Registered nurses are supportive of providing patients with centered care. Kareem et al. 2021 established that through assessment, planning, and interdisciplinary collaboration, nurses help in meeting patients' needs. All of these activities ensure continuity of care, allowing patients to become more engaged and active in their healthcare process. By focusing on communication, engagement, and personalized care, nurses have much to offer in improving collaboration with patients and their families in care coordination. Ethical decision-making in care coordination. The American Nurses Association, more known as ANA, Code of Ethics is an essential guiding framework for nurses in decision-making if they want to align their decisions with the highest professional values. Haddad and Geiger 2023 stressed that this code provides a firm framework for resolving many of the moral challenges that have recently arisen in the contemporary healthcare. Nurses in care coordination face many challenges and must be guided through their ethical challenges, as these decisions have a far reach to the diverse and often vulnerable patient population. The application of ethical framework reveals that nurses encounter different care coordination dilemmas. Haddad and Geiger of 2023 highlight that nurses use autonomy, benefits, justice, and non-maleficence principles. Nurses act on behalf of patients, and autonomy means respect for and constantly supporting patients' decision-making about their care plan. At the same time, benefits encourage nurses to act in their patient's best interest to benefit as much and as little harm as possible. In other words, non-maleficence is about not harming the patient, while justice is about a fair or balanced distribution of resources and services in healthcare. However, putting these ethical principles into practice can be difficult, especially when patient needs don't mesh with healthcare policies or the limitations of available resources. Haddad and Geiger 2023 state that the primary common ethical challenges of Care coordination includes confidentiality concerns, complexities of informed consent, and care for non-compliant patients. Rigorous use of moral guidelines, better communication strategies, and better ethical training programs for nurses are proposed solutions. These measures allow the nurses to deliberate facts about these ethical issues and avoid distribution of care processes. Change management in patient-centered care. Change management is a systemic approach essential for facilitating change within healthcare settings and improving patient-centered healthcare. Generica et al. 2023 reported that change management is critical to the health team as helps them adjust to new methods and policies to ensure that patients' care adapt to changing health demands and escalating quality. Nurse-led interventions superhead such interventions. Generica et al. 2023 point out that specific interventions such as training programs for staff and can ultimately build the competencies in the health professionals to adopt and implement new practices. Furthermore, environmental changes are made in healthcare settings to improve patients' safety and comfort, making care more patient-centered care. These interventions help ensure that changes promote health outcomes and are consistent with the core principles of compassionate coordinated care for patients. Impact of health care policies on care coordination. Care coordination efforts and patient outcomes are highly influenced by healthcare policies that structure the care delivery processes. According to Couturi et al. 2023, policies that enable comprehensive care models and resource allocations for integrated services help improve the management of patients with complex needs. These policies increase availability where appropriate and promote smoother transition between care settings, better communication amongst care providers, and continuous and comprehensive patient care. Nurses shape these healthcare policies. Couturi et al. 2023 state that as a frontline provider, nurses have a special understanding of patient care and care coordination barriers. Nurses can help shape exactly how policies are developed and changed for the better by participating in policy development and advocacy. Their contributions are essential in ensuring that policies are theoretically sound and pragmatically right, improving health outcomes and patient care experience. The nurse's role in care coordination. Care coordination is central to the scope of work for nurses in their direct provision of patient care in addition to their broader tasks within the organization. Kareem et al. 2021 state that nurses assess patients' needs, develop and update care plans, and communicate between various care teams. This broad involvement allows them to coordinate and synchronize many parts of patient care, which minimize gaps and provide for good transition so that the patient care pathway is continuous and well coordinated. Nurses are responsible for significant leadership and advocacy roles and hands-on care duties within the healthcare system. As Kareem et al. 2021 note, nurses spearhead efforts to establish and improve care coordination practices, and they often champion policy changes to improve the quality and effectiveness of healthcare services. Hence, their unique position at the intersection of patient interaction and system oversight makes their availability to advocate for enhanced care practice indispensable in healthcare settings. Conclusion. In conclusion, nurses play a role in care coordination, ethical decision-making processes, and change management, ensuring care is patient-centered, efficient, and effective. They work in complex care settings and are very moral and are interested in driving changes towards better healthcare delivery. This presentation raised the issue of the very important roles of nurses as leaders and performers of care coordination strategies related to the needs of patients and system expectations. It motivates nurses to use and practice what they have learned in the course and to advocate for effective policies that will result in meaningful patient care outcome excellence. With such dedicated effort, nurses can improve the quality and reliability of health services.